Do you have kids? Do you have stuff?
No, I've not brought one, because the main thing was what Natalie was saying. Good morning, everybody. My name's Ian Kenworthy. I'm a patient and I've got very severe COPD. I've never smoked, as the lady over here was saying, but I've worked in atmospheres where the majority of people smoked. I've had asthma since I was a baby, so I've had a lot of passive smoking, both from work and social interactions. I also am very involved with our CCG in developing and improving respiratory services. 15 years ago, I was told there was nothing more they could do for me. I was on the maximum treatment and there was nowhere I could go. So I did a lot of research, and I'm better now than I was 15 years ago, because I pushed for pulmonary rehabilitation when I found out that it was available in other areas but not in Thames and Glossop. And I pushed for that for a long time. I demanded to see our primary care trust, as it was then, the chief executive, and he got passionate about it as well, and eventually we got pulmonary rehabilitation into the agenda. It's the only thing that will help. I've done pulmonary rehab 3 times now. First time was to get me exercising. The second time was because I was having an exacerbation and I wanted to build up my strength and get me out there again, because I knew it worked. And the third time, I was admitted to hospital about 3 years ago, and I walked into my GP, who sent for an ambulance and said, "How have you got here?" I said, "Well, I've driven down part-time side, I've got an emergency appointment." And he said, "You're going in hospital. There's no way you're driving back. Where's your car parked?" We sorted all that out, and he sent for an ambulance. I finished up in Thames, as I say, I walked in. I was in there a week. Got finally discharged. I had to be wheeled out in a wheelchair. Now normally I walk about, I'm fine. Going up hills are a problem, going upstairs are a problem. But normally I'm okay. It took me 3 months before I could do anything, really. I was a mess. I had a close working relationship with my respiratory nurse at hospital, who saw me on an emergency basis, and I got oxygen in at home. I still have ambulatory oxygen, which is, if I go to the gym, I use oxygen when I'm exercising, because I push myself, because I know the benefits of it. Forget rehab. I hate the term pulmonary rehabilitation because nobody knows what it is. I know Natalie feels the same, but that's what she's stuck with, really. That's what it's called, and that's it. Rehab is trying to get you off drugs, or trying to get you back into work, but it's not anything at all to do with that. It's about to improve your health. They'll teach you breathing techniques, they'll teach you bits of exercise. Exercises are simple. Sit to stand, or just sitting on the chair and standing up, which exercises these muscles. These are the biggest muscles in your body, and what you need for walking about. You can build these muscles, what are they called?
Quadriceps.
You can build your quads.
Thigh muscles.
Yeah.
Oh,
build your quads, which are these. That will help you walking. You won't get as much out of breath, because using these, walking about, you're using a lot of oxygen. Now I'm getting into physiology and that, and I'm nowhere near as experienced, so I'm certainly not qualified as what Natalie is, but that helps. Do it, and I know you won't regret it. That's really all I've got to say, unless anybody's got to ask me any questions on pulmonary rehab. Now, I also run the local Breathe Easy group, which helps with, it's more of a social group, but we do have speakers. Natalie has come and spoke to the group on several occasions about pulmonary rehab, about advances in medication, and what is good also on pulmonary rehab, they will check what medication you're on, because you've got a pharmacist who will come along and look. You might not be on the right medication for you. They'll also check whether you're using your inhalers correctly. No, Catriona will be checking when you go for your annual check, or however often you go, that you're using your inhalers correctly. but you always learn something different. You'll always be doing something that's not quite right. So we do repeat that. If anybody's interested, we meet on the 3rd Thursday of every month at 1:30 at the Grafton Centre, which used to be Pensioners House. You just come along, you don't need an appointment or anything like that, and join in. Anybody wants a leaflet, please take one. We aim to improve your knowledge, help socially, make friends, be interactive, and also improve your health. Okay, has anybody got any questions?
No, I've got a few really, more or less, that help me health-wise, is because I have bronchitis, right, at both sides. Now, this side, I've had injections. This side, I cannot lie on that side whatsoever. Now, I keep saying I'm going to come back and see Dr. Hammond to send it back up, just because it is ridiculous. I can't tell you what the pain is like.
Yeah,
it's terrible.
Yeah.
And when I first came and went to physio, they said they found it very unusual that I got it, because they reckon only skiers get it. And I said, well, I clean. I said, and if you think about it, I'm going that way, this way, I'm still using this. I said, oh, I'm going that way and this way, I'm still moving that. So anyway, that was, but and then on the other hand, I'm also on a heart tablet. So the only thing that I'm really a bit mad about is the exercise.
Yeah, but they're all tailored to individuals.
And we
it's not everything.
That's another thing I suffer with.
They won't shut you in and say, you do everything that fit fellow over there does. No, it's to you, it's for you personally.
I'm all for it.
We'll check your blood pressure, we'll check your heart rate, we'll check with the doctor that everything's, if I need to go to your cardiac consultant, I'll speak to your cardiac consultant, make sure everything's stable. We're into doing things safely and effectively.
No, brilliant, yeah.
They used to keep slowing me down because my heart rate used to keep going up. So they do keep your eye on you.
Yeah.
Brilliant.
Did you say once a week, these sessions, or is it twice a week?
Pulmonary rehabilitation is twice a week. Yeah. But you don't have to go, if there's something else on, you do something else, you don't have to go, as Natalie said. As long as you can try and get there and do a bit more after the 6 weeks is finished, go on to the next programme. You might repeat some of the things, but
you just get a bit of structure. I think you come along and it's like once a week, 6 weeks. You've got other responsibilities, and I'm not into curbing people. It's 6 weeks of a chunk of your time, really.
Well, they lunging and two days a week what to do at home, don't they?
The thing is, you'll teach you simple exercises that you can do at home.
Yeah, and that's the main thing.
Yeah.
And we see improvement. It's not ideal if you haven't done the 12 things, but we do see improvement in whatever they've done. You think about it, you're doing more than what you would have been doing anyway.
Yeah.
So we just urge you to come, and we'll do what we can to get you through. I want these barriers down. I don't want. This is why the referral criteria is, let's keep it as simple as possible. If you've got a breathing condition that's affecting you on a day-to-day basis, the things that Ian said, then pulmonary rehab might be for you. And if it's not for you, that's fine, but at least you know about it.
Go, give it a try. You're losing nothing. Don't cost anything.
No.
Well, surely for myself, like I'm trying to walk a mile a day, every day if I can, which I virtually do. And I found that does help, if you're prepared to just help yourself as well, isn't it?
Yeah, use it then.
Yeah.
Yeah.
Alright, thanks a lot.